Hello, today we will talk about Mast Cell Activation Syndrome, or otherwise known as MCAS. There was someone who questioned me that while they found LDN to be an excellent tool, that it seemed to have made their MCAS or Mast Cell Activation Syndrome much worse. So I've seen this in several people, and it is something that really can get in the way of treatment using LDN therapy. Because if you trigger MCAS, really people can't really go higher on the doses of LDN. So in functional medicine, we're always interested in identifying the root triggers. So there are multiple things that can cause it, and I think it's very important to look into all of them. That can be chronic infections, food insensitivities, environmental allergens, toxin exposures, such as mycotoxins or heavy metals, chemicals, severe dysbiosis or SIBO or hormone imbalances, and stress or trauma. Although I think that stress and trauma tends to make it worse, but not necessarily root causes. And I think diet does play a huge part in this, and there's low histamine diet, low FODMAP diet. The thing that I find the most helpful actually is an anti-inflammatory diet in the form of converting the metabolism itself into burning fat. So there are some supplements that can be helpful to stabilize mast cells, and that includes using things like quercetin, vitamin C, DAO or diamine oxidase, magnesium, omega-3 fatty acids, curcumin. So it's important to introduce one at a time, because you don't want to cloud the picture. And often people with MCAS or MCAS really suffer a lot. So they want to go as fast as possible, but it's really not the best idea, because you need to go slow and systematically, and that makes a big difference. So there's addressing the gut health, addressing the nervous system regulation, environmental detox, and use of pharmaceuticals like H1, H2, antihistamine, mast cell stabilizer, and leukotrienes inhibitor. And in addition to it, in functional medicine, we have additional tools that can stabilize mast cells that comes from compounding pharmacies, and that can be very helpful. So I had a patient that pretty much LDN made everything better, and then all of a sudden patient said, I can't go up anymore because every time I eat I get severe food allergy reactions, and before taking LDN it wasn't that bad. There was another person I recall that the LDN actually made allergies better but eczema worse. So there's a phenomena, I think, that as LDN normalizes or immune modulates or normalizes immune system, there appears to be a side effect that other parts like eczema, other parts like the mast cell or histamine release reaction does not appear to be regulated by LDN, and in some cases, anecdotally, appear to make things worse for some people. So in these cases, I recommend that you work with your physician, functional medicine physician, to explore the root causes if applicable, and then move forward with your treatment. I think the LDN treatment sometimes can make MCAS better, but I wouldn't say it's not as universal as what I've seen with LDN to calm down the immune system in general, with exception of histamine-related system, and calm down the nervous system. But it is something that I have seen. So I hope you found this helpful. If you found it helpful, give me a thumbs up and subscribe to the channel. Thank you.